morning. So we're back, and we are back on October 14th still. And during our last video, we're gonna maintain our patient's chest tube. Here's my patient's chest tube. She's on a water seal chest drain, okay? So with a chest tube, the most important thing that you need to be mindful of is the chest drainage. This drainage system needs to always be below the patient's chest. It's never okay for the patient to be lying in bed with the chest tube laying in bed next to them. It needs to be below the patient's chest. So most times, if they're maybe connected to an IV pole, you can have it attached to the IV pole or even attached to the bottom of the bed, the side railing of the bed maybe. But it needs to be below the patient's chest. So we're maintaining our patient's chest tube. I just got on shift, so I'm going around checking my patients, doing my rounding, getting a report on all of my patients. So I see that my patient has a chest tube, so I'm gonna go ahead and assess the chest tube as the first thing that I need to do. So I'm gonna go ahead and perform my overall head to toe assessment as I would on any patient, but I would go ahead and listen to their heart sounds, and I would do a lung assessment, and those would be the most important that I need to do. So once I've done that, I'm assessing the lung sounds and the heart sounds to see what's going on, see if there's anything abnormal. And my patient sounds pretty normal, being that they're with them being on a chest tube. So I've done those assessments. So now I'm gonna monitor my chest tube. So I'm coming on shift. So I would go ahead and mark wherever there was drainage last in the time here. I would put 0700 if that's the time that I'm coming on shift. Mark it there just so I can keep note of how much drainage we got from the point that I started shift and the point that I ended shift. Just so we can have a better documentation of it, and the doctor can have an idea of how much my patient is putting out in what periods of time. So now that I've done that, I've checked my drainage. If I see in my air leak monitor down here that there's some bubbling, I can go ahead and check the tubing. I would use my clamp, and I would start closest to the patient's dressing site, and I would clamp it there just to see if the bubbling stopped. In my case, I have no bubbling in my air leak monitor, so I wouldn't need to do that. But in case that there was, I just got scared because I thought my video wasn't recording. Anywho, in the case that it was some bubbling and my patient, there may have possibly been a leak somewhere in my patient's tubing, I would clamp it starting at the dressing site to see if there's a leak closer to the patient, and I would just go every few inches all the way to the top of the tubing at the drainage system. And wherever I see the leak, I can go ahead and change out the tubing. Sometimes I may even need to change out the entire drainage system. But being that my patient's drainage system is working perfectly fine, we're getting some good output. Right now we're at 140, so I've already noted what time it is and the date, so that we can see where my patient's at the end of shift. I would monitor my patient's drainage system about every 2 hours, just to keep track and know exactly what it is that I'm finding. I would also note the color of the drainage. What type of drainage is my drainage? Purulence, serosanguinous. What type of drainage I'm getting out. I would also note that in my nurse's note on my patient's chest tube. If we're transporting my patient, as I'm moving the drainage system, I'm always going to keep it below the patient's chest. And I can just go ahead and attach it at the foot of the bed. Most of the drainage systems have a hook, which I've actually seen in the facility. They have a hook where you can just hook on the edge of the bed. You don't want it lying down flat. You don't want it standing up, laying in bed right next to the patient, because again, we always need the patient's, this is my thing saying my parts of my suctioning. We always want our patient's drainage system to be below their chest. And that's about it with my chest tube. So here's my beautiful chest tube on my cereal box. And that is all. Thank you.